Hello, I am Dr. Sunny Gugale. I am an orthopedic surgeon, sports medicine specialist and a robotic joint replacement surgeon. I am practicing here since last 15 years. My Happy Joints clinic is in Pune Swargate area. Today, I am going to introduce you all to a very important and a complex structure of your body known as the knee joint. Why it is complex? Because a lot of different structures are involved in a knee which take care and has a role to play. Every structure is very important because every structure has an assigned function and an assigned work. If there is a problem in any of these structures, then your knee joint is going to be at a risk of having knee pain and knee discomfort repeatedly. So, to understand the knee in details, we are going to see on this model about the structures around the knee joint. Importantly, the knee is made up of these following structures. There are three important bones, which is the femur, the thigh bone, the leg, the tibia bone, and the kneecap bone. These three structures, the three bones, they form the knee joint. Now these three bones are connected to each other by a number of ligaments. The most important ligament on the inner side of the knee joint is known as the medial collateral ligament. There is an important structure on the outer side of the knee joint known as the lateral collateral ligament. There is a structure inside the knee joint in the front known as the ACL ligament or the anterior cruciate ligament. There is a structure at the back of the knee joint known as the posterior cruciate ligament. There is an important structure which connects your kneecap to your leg bone known as the patellar tendon. These all ligaments are very important for having a good and stable knee joint. After we have seen these ligaments, there are two cushion-like structures in the knee joint. One is on the inner side of your knee joint, one is on the outer side of your knee joint, known as the medial meniscus and the lateral meniscus respectively. There is a very important structure in your knee joint known as the knee cartilage. The knee bones, the knee bone ends in your knee joint are covered by a smooth glistening coating known as the knee cartilage, which is there at the end of your thigh bone, which is there on the top of your leg bone, and which is also there on the inner side of your kneecap bone. This cartilage is a very important structure because that takes the entire stress of all the activities that you do during your day-to-day lifestyle. Apart from these structural things, there are two very important muscles that help to function our knee joint. The muscle in the front of the knee joint is known as the quadriceps muscle, and the muscle at the back of the knee joint is known as the hamstring muscles. So, if you have any problem in any of these structures, right from your muscles, your cushions, your ligaments, your cartilage, your bones, there is going to having a knee problem. So, now what all things can go wrong? You can have ligament tears, you can have meniscus injuries, you can have focal cartilage damage, and you can also have muscle weakness around the knee joint, and that is how your entire knee joint is at a risk of having a lot of problems if any of these structures are affected. When we have seen this structure of the knee joint, it is very important to know the injuries associated with the structures. So in the subsequent videos, I am going to discuss with you all in details about each and every structure that is getting affected in the knee joint. Most important injuries that we come across and you would have heard from your friends and families is having a ligament tear in the knee joint, or having a cushion injury or a meniscus tear in the knee joint. What does that mean? What implication it has on your knee joint? What implication it has on your knee function? Are we going to see them in the detailed subsequent videos? Thank you.